Welcome to Pediatric Case Review. Today we're discussing chickenpox in pediatrics, providing a comprehensive yet practical overview for clinical practice. This lecture will cover epidemiology, clinical presentation, diagnosis, treatment, and prevention through case-based scenarios. A 6-year-old presents with fever and vesicular rash. The parent asks about disease transmission. Which statement about varicella epidemiology is correct? A. Contagious from 1 day after rash appears until crusting. B. Contagious from 1 to 2 days before rash until all lesions crust. C. Only transmitted through direct contact with lesions. D. No longer common in vaccinated populations. The correct answer is B. Varicella is highly contagious beginning 1 to 2 days before rash onset until all lesions have crusted. This makes containment challenging as transmission occurs before diagnosis. The virus spreads through both respiratory droplets and direct contact with vesical fluid, with an incubation period averaging 14 days. Chickenpox is caused by which virus? A. Human herpes virus 1, HSV1. B. Human herpes virus 3, VZV. C. Human herpes virus 5, CMV. D. Human herpes virus 6, Rosella virus. The correct answer is B. Chickenpox is caused by human herpes virus 3, also known as varicella zoster virus or VZV. This DNA virus belongs to the herpes virus family and establishes latency in sensory ganglia after primary infection. Later reactivation of this virus causes herpes zoster, commonly known as shingles. A 4-year-old develops fever followed by pruritic rash, which describes the typical progression of chickenpox lesions. A. Macules to papules to vesicles to crusts. B. Vesicles to papules to pustules to crusts. C. Papules to macules to vesicles to crusts. D. Vesicles only, without progression. The correct answer is A. Chickenpox lesions classically progress from macules to papules to vesicles, finally forming crusts. A hallmark feature is lesions in different stages simultaneously present on the body. The vesicles have been described as having a dewdrop on a rose petal appearance. Each individual lesion typically completes this evolution within 24 to 48 hours. A 5-year-old presents with vesicular lesions. Which distribution pattern is characteristic of varicella? A. Primarily on extremities. B. Concentrated on palms and soles. C. Centrifugal, face and extremities. D. Centripetal, trunk, face, and proximal extremities. The correct answer is D. Varicella has a centripetal distribution, meaning it's concentrated on the trunk, face, and proximal extremities. The rash typically begins on the face or scalp, quickly spreading to the trunk where lesion density is highest. The distribution differs from smallpox, which has a centrifugal pattern. Chickenpox can also affect mucous membranes, including the oral cavity. A 7-year-old with suspected varicella presents for evaluation. Which examination finding would be most expected? A. Koplik spots on buccal mucosa. B. Strawberry tongue. C. Lesions in multiple stages of development. D. Maculopapular rash sparing the trunk. The correct answer is C. The pathognomonic feature of varicella on examination is lesions in multiple stages of development simultaneously. Unvaccinated children typically develop 250 to 500 lesions. Associated findings may include lymphadenopathy and mild hepatomegaly. Koplik spots are characteristic of measles, while strawberry tongue is associated with scarlet fever. A 6-year-old presents with fever, malaise, and anorexia. How long do prodromal symptoms typically last before rash onset? A. No prodromal symptoms occur. B. 1 to 2 days. C. 5 to 7 days. D. 10 to 14 days. The correct answer is B. Prodromal symptoms typically last 1 to 2 days before rash appears. These symptoms include low-grade fever, malaise, headache, and sometimes anorexia. Interestingly, prodromal symptoms are often more pronounced in adolescents and adults, while young children may have minimal or no prodromal phase, with rash as the first sign of infection. An 8-year-old with vesicular rash requires confirmation of diagnosis. Which is the most appropriate diagnostic test for varicella? A. Zinc smear. B. PCR of vesicular fluid. C. Serum IgM antibodies. D. Skin biopsy with immunohistochemistry. The correct answer is B. PCR testing of vesicular fluid is the most sensitive and specific diagnostic method for confirming varicella infection. However, in most immunocompetent children, the diagnosis can be made clinically based on the characteristic appearance and distribution of the rash. Laboratory confirmation becomes more important in complicated cases, atypical presentations, or immunocompromised patients. A 5-year-old presents with vesicular rash in various stages. Which condition is most commonly confused with varicella? A. Herpes simplex infection. B. Smallpox. C. Impetigo. D. Hand, foot, and mouth disease. The correct answer is D. Hand, foot, and mouth disease is commonly confused with varicella, especially in young children. Key differences include HFMD's concentration of lesions on the hands, feet, and mouth, with fewer total lesions than typical varicella. Herpes simplex typically presents with grouped vesicles in a limited area. Impetigo features honey-colored crusts without the classic vesicular stages seen in chickenpox. A 6-year-old with confirmed varicella has routine labs drawn. Which laboratory finding would be most expected? A. Leukocytosis with neutrophil predominance. B. Transient lymphopenia followed by lymphocytosis. C. Elevated liver enzymes, ALT/AST, in all cases. D. Thrombocytosis. The correct answer is B. Varicella typically causes a transient lymphopenia in the early phase, followed by lymphocytosis with atypical lymphocytes. Mild elevation of liver enzymes occurs in 20 to 30% of cases, but is rarely clinically significant. It's important to note that routine laboratory investigations are generally unnecessary in uncomplicated varicella cases in otherwise healthy children. A 7-year-old with varicella has moderate pruritus. Which is the most appropriate initial treatment? A. Oral acyclovir for all patients. B. Topical antivirals to prevent bacterial superinfection. C. Supportive care, antipyretics, antihistamines. D. Corticosteroids to reduce inflammation. The correct answer is C. For most healthy children with uncomplicated varicella, supportive care is the mainstay of treatment. This includes antipyretics for fever, antihistamines for itching, and keeping the skin clean to prevent secondary infection. Acetaminophen is preferred. Aspirin should be avoided due to the risk of Reye syndrome. Simple measures like trimming fingernails and oatmeal baths can help manage pruritus. A 10-year-old with varicella presents within 24 hours of rash onset. For which patient is acyclovir most indicated? A. All children with varicella regardless of timing. B. Children over 12 years, adults, and high-risk groups. C. Only immunocompromised patients. D. Only if bacterial superinfection is present. The correct answer is B. Acyclovir is indicated for children over 12 years, adults, and high-risk groups, including those with chronic skin or pulmonary disorders. It's most effective when started within 24 hours of rash onset. The typical dosing is 20 mg per kilogram per dose, maximum 800 mg, given 4 times daily for 5 days. For healthy children under 12, antiviral therapy is generally not recommended. A 6-year-old with varicella develops increasing fever and localized skin tenderness. Which complication of varicella is most likely? A. Encephalitis. B. Bacterial skin superinfection. C. Reye syndrome. D. Cerebellar ataxia. The correct answer is B. Bacterial skin superinfection is the most common complication of varicella, occurring in 2 to 5% of cases. Typical pathogens include group A Streptococcus and Staphylococcus aureus. Warning signs include increased pain, erythema, warmth, and purulent drainage from lesions. Treatment often requires systemic antibiotics with coverage for both streptococcal and staphylococcal infections. An 8-year-old with varicella develops ataxia 7 days after rash onset. Which statement regarding cerebellar ataxia in varicella is correct? A. Occurs in approximately 50% of cases. B. Typically results in permanent neurologic damage. C. Usually occurs 7 to 10 days after rash onset. D. Requires immediate antiviral therapy with acyclovir. The correct answer is C. Cerebellar ataxia typically occurs 7 to 10 days after rash onset. This is a rare complication, affecting approximately 1 in 4,000 varicella cases. Despite its concerning presentation, cerebellar ataxia associated with varicella is usually benign and self-limiting, with complete recovery in most cases within 2 to 4 weeks. Other neurologic complications include encephalitis, aseptic meningitis, and Guillain-Barré syndrome. A pediatrician is assessing risk factors for severe varicella. Which patient has the highest risk for severe varicella? A. 12-month-old previously healthy infant. B. 5-year-old with asthma on inhaled steroids. C. 10-year-old on chronic high-dose oral steroids. D. 16-year-old with history of eczema. The correct answer is C. Children on chronic high-dose oral steroids are at significantly increased risk for severe varicella due to immunosuppression. Other high-risk groups include children with malignancies, HIV, or congenital immunodeficiencies, neonates whose mothers develop varicella around delivery, adolescents and adults, and pregnant women. These patients often require prophylaxis or prompt treatment if exposed. A 15-month-old is due for routine vaccinations. Which statement regarding varicella vaccination is correct? A. Single dose provides lifelong immunity. B. Recommended at 12 to 15 months and 4 to 6 years. C. Contraindicated in children with egg allergies. D. Provides 50% protection against disease. The correct answer is B. The varicella vaccine is recommended as a 2-dose series, with the first dose at 12 to 15 months and the second dose at 4 to 6 years of age. This vaccine is approximately 85% effective after 1 dose and 98% effective after 2 doses in preventing disease. It's a live attenuated vaccine not produced in eggs, so egg allergy is not a contraindication. A 2-year-old unvaccinated child was exposed to varicella at daycare. Which is the most appropriate post-exposure prophylaxis for this child? A. No intervention needed. B. Varicella vaccine within 3 to 5 days. C. Varicella within 10 days for all exposures. D. Prophylactic acyclovir for 7 days. The correct answer is B. For healthy unvaccinated children exposed to varicella, the vaccine can be administered within 3 to 5 days of exposure and may prevent or attenuate disease. Varicella zoster immune globulin, or varicella, is reserved for high-risk individuals such as immunocompromised patients, neonates, and pregnant women. Acyclovir prophylaxis is sometimes used as an alternative when vaccination is contraindicated. A 5-year-old develops varicella rash on Monday. When can this child return to school? A. After fever resolution, regardless of rash status. B. After all lesions have crusted over. C. 5 days after rash onset regardless of lesion status. D. 24 hours after starting antiviral medication. The correct answer is B. Children with varicella should be excluded from school until all lesions have crusted over, which typically occurs 5 to 7 days after rash onset. This ensures they are no longer contagious. The criteria include having no new lesions forming and all existing lesions crusted. This recommendation may be modified for vaccinated children with breakthrough infections who often have milder disease with fewer lesions. A 16-year-old with history of varicella at age 3 presents with painful unilateral vesicular rash. Which statement about VZV reactivation is correct? A. Occurs equally in pediatric and adult populations. B. Presents as widespread vesicular rash. C. Follows dermatome distribution. D. Requires repeat vaccination to prevent. The correct answer is C. Varicella zoster virus reactivation presents as herpes zoster or shingles, which follows a dermatome distribution. While rare in children compared to adults, pediatric herpes zoster can occur, especially in immunocompromised patients or those who had varicella at a very young age. The rash is unilateral and confined to one or occasionally multiple adjacent dermatomes, unlike the generalized distribution of primary varicella. A mother develops varicella rash 2 days after delivery. What is the most appropriate management for the newborn? A. Observation only. B. Varicella vaccine. C. Varicella and observation. D. Varicella and prophylactic acyclovir. The correct answer is C. When a mother develops varicella around delivery, the newborn should receive varicella and be observed closely. The highest risk period is when maternal rash develops from 5 days before to 2 days after delivery. Varicella should be administered as soon as possible, ideally within 96 hours of birth. Without intervention, mortality from neonatal varicella can reach 30%. The infant should also be isolated from the infectious mother. A 12-month-old is due for varicella vaccination, which is an absolute contraindication to varicella vaccine. A. Mild acute illness with low-grade fever. B. Current treatment with inhaled corticosteroids. C. History of anaphylaxis to neomycin. D. Recent exposure to varicella. The correct answer is C. History of anaphylaxis to neomycin, which is a component of the varicella vaccine, is an absolute contraindication. Other absolute contraindications include severe immunodeficiency, pregnancy, and high-dose systemic corticosteroids, mild acute illness, inhaled corticosteroids, and recent exposure to varicella are not contraindications to vaccination. Thank you for joining this comprehensive review of chickenpox in pediatrics. Remember that while varicella is typically mild in healthy children, recognizing high-risk patients and potential complications is essential. Vaccination remains our most effective prevention strategy. If you found this information helpful, please follow the Pediatric Case Review channel for more educational content. We welcome your questions in the comments section below.